Hey everybody, welcome back to the Fit Responder blog. I assume you're here because you've either read a few of my articles or done some searches, or hopefully you're in the business and you found the book and the website, and hopefully have learned a good bit. I want to do a real short post today on knee pain. I was talking to a buddy of mine who is a police officer. He's a tactical guy, and was having some knee problems. Non-traumatic, can't recall any injury, no swelling, no clicking, no locking, nothing, quote unquote, provocative orthopedically. Ligaments were intact, joint capsule appeared to be intact. But when I assessed his IT band or iliotibial band, very, very tight. He's tight bilaterally, both sides, but much, much tighter on the side that he was having pain. And one of the tests in the Fit Responder book, and one that I hopefully will be on emsresponder.com soon, which is an overhead squat profile, which is adapted from the National Academy of Sports Medicine, will actually screen for that. Very good test. I had this gentleman perform it, and it was positive as well. Like I said, I had assessed him more from an athletic training, sports medicine standpoint, and showed him how to very, very easily, using a tennis ball against the wall, to actually roll or self-massage the IT band and up into the lateral hip and glute where the IT band originates. Had him repeat the test after we rolled with the tennis ball, and had him go through some movements that previously had been provocative, and he was pain-free. His knee no longer tracked medially toward his midline when he was doing some of those movements. So my point, as I'm rambling on and trying to make something rather complicated mechanically simple, is as long as you're having non-traumatic knee pain, and this goes for a lot of joints in the body, if you can identify some causative factors, which is what I go into depth with extensively in the book, there are self-treatment options for you to prevent further pain and injury. Now, the downside to that kind of knee pain that this gentleman was having is, had it gone untreated, so to speak, where he just kind of said, it'll go away, I'll stretch it, pretend it's not there. Eventually, you'll start to have joint degradation and alterations in joint mechanics, which will lead to an injury. Statistically, nobody questions that. So, as I'm very, very big on, prevention is absolutely the key. So something as simple as, an overhead squat profile to check for a movement anomaly, and then to basically do some palpation and find out that one side of the leg is exponentially tighter, more painful to palpation, compared to the opposite side, pretty much tells you where the problem lies. And we took a very simple corrective action like self-massage with a tennis ball, and hurts like hell, but it's incredibly effective, and pain was gone. So he was able to perform and do his activities. And like I said, he's a tactical police officer, and was able to run and do things that were pain-free. So simple, quick fix. Like I said, check the article that should be up the next month or so on EMS Responder, and I go into depth at length on in the Fit Responder book. So good luck, stay safe out there.